Mental health. This question came in and took me a few minutes to figure out exactly what they were asking, but once I did a little research, I got where this person was coming from. Let me get a drink. So she stated, I am trying to verify exactly what V71.09 means. Now, mind you, this is not ICD-10, this is ICD-9, okay? Or get more specific meaning behind the description. I show two different definitions. No diagnosis is on axis 2 and no diagnosis or condition on axis 1. Now, when you go look up in your tabular, V71.09 states that it's other suspected mental condition. So let's get some background, and that'll tell us, I believe, what we need to know. All right, so V71.09. The Diagnostic and Statistical Manual of Mental Disorders is what DSM stand for. Now, you're going to go and we're going to be working with DSM from this point on. And the axis is referring to how they determine what's wrong with their patient. And again, this is a for mental health. So axis 1 is going to refer broadly to the principal disorder. Then axis 2 lists any personality disorder that may be shaping the current response to the axis 1 problem. Okay, and then axis 3 is going to list any medical or neurological problems that may be relevant to the individual's current or past psychiatric problems. And then we get into axis 4. That codes the major, psychosocial stressors the individual has faced recently. And then last follows up axis 5, codes the level of function. And anyway, this is all based on mental health. So if we're going to see a breakdown of that, we have to think other suspected mental condition, but there's no diagnosis, okay? So with this particular scenario, we have the here is the impression. For axis 1, they have no diagnosis. For axis 2, they have no diagnosis, and none in 3, and educational problems for axis 4, and axis 5, they have a GAF of 85. So let's go look at this other one. We have axis 1, no diagnosis. Now, it's not saying that they don't have a diagnosis per se. It's other suspected mental condition with no diagnosis is what they're saying. So axis 2, V62.89, borderline intellectual functioning, okay? So then they get into axis 3, fetal alcohol syndrome by history, so they know that. And then axis 4, occupational and educational problems. All right, so axis 5 gives them a GAF of 75. So what that is telling you is that this right here is on axis 2, which is any personality disorders that may be shaping the current response to the axis 1 problem is going to be the diagnosis is you're going to be able to state where. Here, I don't want to say the wrong thing. Other suspected mental condition. Okay. Then, if the person has axis 1, same thing, refers broadly to the principal disorder. Okay. This is not. It doesn't mean that axis 1 is not part of the diagnosis code. What it means is that they're using the V71.09 because in axis 1 for the principal disorder there is other suspected mental condition, but they don't have a diagnosis for it yet. And the same thing with 2. Personality disorder that may be shaping the current response to axis 1. Again, other suspected mental condition. Okay, so they don't have a diagnosis yet. So they gave him V71.09. I hope that helps you. It's mental health is not something that I'm as familiar with, but as the tide is starting to change and we're seeing that there is more need for mental health in our society, then I think we're gonna see some more specialties in this for coding. So it's a good thing to get familiar with it. Okay.
Get more CPC exam tips, coding certification training, and CEU credits. Go to www.codingcertification.org.